I started on July 2nd, 1984, right from the beginning. We were in the Bedford office right from the ground up. And we just continued growing and growing and growing.
We had a practice that was one of the better or bigger internal medicine groups in Manchester, and we were very busy. And we heard rumors that Dartmouth was interested in getting into management of an HMO and broadening their base and coming to Manchester.
Well, at the start, we had a two-man pediatric department. Dr. LaRiviere was the chief of the new clinic, but he was also the only other pediatrician. And I came in knowing that I'd have him for backup and vice versa.
So through me, we talked to Dave Connor and in came that group of three. And Sam Dugan and I have been cross-covering, so he came in. And an OB in town named Dr. Ed Childs joined us. We were the original 6.
30 years ago, Hitchcock Clinic, because it was called the Hitchcock Clinic then, decided that they were going to really sort of break the mold and do something different in New Hampshire. It wasn't different in other parts of the country, but it was certainly different in New Hampshire. And we've done very well. We've survived. We've grown. We now have more than 200 providers here. We have more than 800 employees. We take care of 100,000 or so patients in a year. And those things don't happen because someone has an idea. They happen because people work hard and continue to do it. And we ought to be very proud of that.
What makes Dartmouth exciting is the people. I love coming to work. It's so friendly, it's so warming. It's like a family. You know, they're with you in the good times, they're with you in the bad times. We're also supportive of each other.
I think what makes Dartmouth special is all of this. It's the people that are working for Dartmouth. And that's why I'm still here 17 years later. It has very great people and people like Karen. And
We've come to be a big family. We've created a lot of good friends and family here, so we just want to keep going.
To work as part of a physician-led team who puts patients and employees first is just really amazing.
People we work with are second to none, right from, again, the people in the trenches, but also the senior leadership, very supportive.
I think, and I'm sure so many people have said this, but it really is about the people here. Very, very special to the people, and I feel like I really could never leave.
Aside from the great sense of community that you feel with the staff and the pride in what you do every day, it's also the interaction with the families and really getting to know them and building a relationship with them. And when you get to see them outside and just thriving, it's a great thing.
Definitely a strong sense of community here. Community-based roots. We're connected to every aspect of our state.
My role as a family support worker it's wonderful that I'm living and working in the community that I was raised in and helping families to navigate the systems here in the city, whether it's school-related, family-related, helping families, and I just love working for Dartmouth.
All the departments throughout the organization really act as one. There's great senior leadership support. And that's pretty much what's led me to the longevity of my tenure here at Dartmouth. So happy 30th anniversary, Dartmouth-Hitchcock.
I'm really proud to be associated with such a really fine, exceptional organization such as Dartmouth. We really have a great bunch of professionals here who really strive to provide the utmost and really high-quality care for the patients.
We're in a lot of cataclysmic change in medical care, but Dartmouth is trying to stay ahead of that, and I think it's a great place to work.
No other place, as far as I can tell, is anywhere like this in terms of the quality that we provide, both for our staff and for our patients. So happy 30th anniversary, Dartmouth.
Whether I worked part-time, days, nights, weekends, I've always been able to work around my family, which is very important to me. And now I'm here at Norris Cotton Cancer Center, where I've been for almost 5 years, working with an amazing group of people, and I'm very happy.
So Dartmouth-Hitchcock to me is special because it's a community of people that all spend an enormous time trying to strive to provide excellence to our patients and their families.
There are many individuals in the clinic that are very interested in promoting
healthcare within the community. And I think that that makes up the main portion of any successful organization like Hitchcock Clinic. That's why they've been able to be here for 30 years.
I think what makes Dartmouth-Hitchcock Manchester special are the employees. Everyone here is great, and we all have the same common goal, which is giving the best patient care possible.
And I think Dartmouth-Hitchcock has done a really good job at maintaining a level of excellence, which our patients have come to know and trust.
People care about each other, not only in the delivery of health care, but as individuals, and they look after each other, whether it be something that's going on professionally in their life or something personally. There is a true sense of commitment to one another.
Thank you. Thank you for caring for all the patients over all these years, through all the changes that we have to go through. Thank you for caring for each other, which is very, very important, especially in our stressful existence. And thank you for all the work you do in the community. You're a good group of people, you're working very hard, and you're appreciated beyond what you believe.